안녕하십니까, 김경원입니다.
Greetings, I'm Dr. Kim Kyung-won. One of the most common complications we come across when we do sinus surgery is sinus membrane perforation. I'm going to talk about repairing this using fibrin glue. Once sinus membrane is perforated, before I start talking about membrane repair, I want to talk about this waterfall, Puerto Iguazu. This is located between Brazil and Argentina. When sinus membrane is perforated, graft material may flood the sinus cavity like this waterfall. People are concerned about this, and we'll talk today about this. I'm going to talk about sinus membrane perforation, and in order to share my clinical experience, I want to share my clinical experience with you. If you are to remove infected bone graft material, naturally the sinus membrane would be perforated. I want to talk about how I used fibrin glue to repair that case. Second, I would like to talk about how I dealt with a situation where I removed the implant from the sinus cavity and proceeded with sinus surgery. First, I want to share with you one or two studies released recently on membrane perforation. In 2020, Hong Wong and the others announced the following. Sinus membrane perforation is one of the biggest complications in doing sinus surgery. In this study, it says from 0 to approximately 60%. On average, it is 19.5%. This number is smaller than the generally known fact. I think the study includes 0%. I believe the percentage is around 30%. I believe sinus membrane perforation is not contraindication for sinus surgery. You can stop surgery, but even if there's perforation, you can proceed with surgery. In the study, it says that membrane perforation directly is not related to failure of an implant. In this study, risk factors with membrane perforation were evaluated. There are largely anatomical factors and patient-related factors. Among anatomical factors are the sinus membrane thickness. It is approximately 1.5 to 2 millimeter. If it is thinner than this, perforation can occur easily, and if it is thicker than 2 millimeter, it's a pathologic condition and perforation can occur. Presence of sinus septa. This can lead to increased perforation likelihood. If the residual alveolar height is below 4 mm, perforation can occur more frequently. The palatal-nasal recess angle. If it is too narrow, then perforation can occur more easily. Perforation is also related to alveolar antral artery with anastomosis, which we can observe during surgery. It can lead to many uncomfortable situations because it's related to bleeding. Patient-related factors. Most prominent is smoking. Next is preoperative sinusitis, and at times, gingival biotype can come into the play. These are the risk factors. This is a review study published in 2021. This is the same here. It says that sinus membrane perforation is one of the most common complications during sinus surgery. As mentioned, it occurs approximately 30% of the time, 7 to 60% of the time. From 2008, April 30th, 2020, 4 databases, including Medline and PubMed, were reviewed. 1,500 sinus lift cases were reviewed and 3,604 implants were placed. 1,115 implants were placed with Schneiderian membrane repair, and 2,495 implants were placed with undamaged membrane. The survival rate of each are 97.68% and 98.88%. The survival rate itself, it's not statistically significant. Even if there's membrane perforation, it's not a problem in proceeding with the surgery. Another point in this study is that to do membrane repair, collagen membrane is used most frequently. Fibrin glue, PRF, blood clot, and suture are used as well. I'm sure you've heard a lot of lectures on using collagen membrane. Today, I'm going to focus on fibrin glue. As mentioned, comparing the case where sinus membrane perforation occurred and did not occur, based on different studies and my clinical experience, it does not have significant influence on implant's survival rate. However, it does affect the bone formation. However, if you do repair successfully, even if there is membrane perforation, it does not affect the survival rate of implant or prevalence of complication. If you do not do repair properly, it can lead to post-op infection, sinusitis, or negative impact could be had on bone formation and the quality of the bone. How can we do successful repair? As mentioned in this study, collagen membrane is used most frequently. Based on my experience, it's not easy to use collagen membrane, and I want to focus on fibrin glue today. If there is sinus membrane perforation or tearing, in order to prevent complication, the most important thing is to prevent bone graft material spreading into the sinus cavity. We need to keep the graft material in solidified mass to prevent particle migration into sinus cavity. More so than collagen membrane, I use a tissue adhesive fibrin glue. I use Green Plast from GC Biopharma. In order to prevent the complication, if there's perforation, you need to seal it, whether it is folded naturally or not. If there's a perforation, you need to lift the sinus membrane properly so that there's no membrane in between graft material and the host bone. Let me show you a clinical case. I removed the infected graft material and proceeded with surgery. This is an initial visit in 2010. In the upper right, from private clinic, approximately 2 months ago, an implant was placed, the sinus graft was done, but the infection occurred. Implant was removed and the patient was referred to me. At the time of the visit, when I took CT, the left sinus looks quite clean because surgery was not done, but on the right side, infection was somewhat controlled, but you can see that the implant has been removed and graft material was infected. It was difficult to say that bone graft was successful. The patient wanted to do surgery on the left side first where it was clean. The patient refused to use denture. In this case, piezoelectric surgery was done to take a lateral window and bone graft was done. Lateral graft was done. Implant was placed. After placing the implant, I've noticed that the bony wall is quite thin. I used a bovine bone and did GBR. The bony window was grafted in the most vulnerable area. Fibrin glue was used. so that the graft material is fixed. Collagen membrane was used and GBR was done. This is at the time of first visit. This is after placing 4 implants on the left side, and you can see the sinus graft is in the form of dome shape. This is at second surgery. So lateral cortical window was placed on top of the second implant. 6 months later at secondary surgery, you can see healing is being made nicely. Surgery was done on left successfully. The patient wanted surgery on the right side as well. When I opened the flap, the bone graft material within the sinus due to infection. Although 7 months have passed, it was not bone, so I thoroughly removed it. I'm not sure whether you can see it, but the infected bone graft material were all removed, so sinus membrane was almost gone. It's beyond perforation. The sinus membrane was very severely affected. Bone graft was done. I used allogenic bone on the host bone side and used bovine bone on top. I used a fibrin glue to do fixation. On top of graft material, if the Schneiderian membrane is not intact, you can use fibrin glue so that it is not dispersed within the sinus cavity. If you look at the far right, surgery was done on the left first, and then with time I did surgery on the right. This is at second surgery. This is the final panoramic image. In the case of left, it's been about 2 years and 6 months, and on the right, it's been over 2 years. When you compare left and right, compared with the left, bone formation is slightly less on the right side, but you can see that graft material is well maintained and there's no problem with the implant itself. Let's look at fibrin glue deeper. People ask me how to use it very frequently. If you look at the model, if the membrane is fully perforated, you need to lift the remaining sinus membrane and you fill the graft material on the lower side. This is the model, so the material is falling out, but the membrane actually is lifted and green plast Q. This is normally frozen. You need to defreeze it, connect it to the syringe very easily. You can see that the liquid mixture is being mixed. It's very easy to use clinically. People don't really understand what I've mentioned on clinical surgeries, so I wanted to show you using this model for better understanding on your part. You can see that bone graft is done. Fibrin glue is used for Schneiderian membrane repair. You can see that fibrin glue is used so that the graft material is not dispersed into the sinus cavity. If there is no sinus membrane, if you use the fibrin glue on top of the graft material, it spreads like water and it sets very quickly, so you can use it very easily. Even if there's membrane, if you look at the model, if you squirt it like this, you don't need to try to find where the perforation is. You can just squirt it on top of graft material and do sealing. Sealing is made very nicely. Fibrin glue or tissue adhesive. You can use green plast from GC Biopharma or berry plast from Germany or Tisseal from Austria. I've shown you on the model, but it's very easy to use. It's made of liquid, so it's very easy to apply. Compared with PRF or PRP, application is very easy. And you can do easy repair of sinus membrane. If you use fibrin glue, graft material can be fixed very easily, so it does not disperse within the sinus cavity. Based on my experience, Compared with collagen membrane, it's much easier to do the repair. As mentioned, this is green plastic cube. It's frozen. It's already set. If you look at the component, there's a fibrinogen solution and thrombin solution. In fibrinogen solution, there is a fibrinogen concentrate and aprotinin solution. Aprotinin has anti-fibrinolytic property, which prevents a rapid disintegration of the mass.
고형이 성분이 빨리 녹아서 없어지는 것을 막아주는 성분입니다. 그렇게 된 것이 되고 이 피브린 글루 자체는 앞에서 말씀드렸듯이 지금 보시면
Fibrin glue imitates the final phase of the blood coagulation process.
파이널 페이스를 그대로 흉내낸 겁니다. 그래서 이미테이션 한 거기 때문에 어떻게 보면 어디
This has very good adhesion, and it is like a blood clot. As mentioned, due to aprotinin, there's slow disintegration or there's no rapid fibrinolysis, and the network is formed and maintained. The tissue adhesive itself, as mentioned and shown on the model, if you squirt it, it sets very quickly. The maximum adhesion, it takes about 2 hours. When you spray it on the human body, it sets immediately, so you do not need to wait during surgery. You can just squirt it and see it set and then proceed with suture. The tissue adhesive itself is maintained at least for over 2 weeks, and gradually it goes through fibrinolysis and phagocytosis. In general, compared with using blood clot, you can do repair much easier after sinus surgery if it is stabilized for 2 weeks without infection. Then repair would occur nicely. Fibrin glue is not really well known in the dental field, but it is used widely in surgical disciplines for tissue adhesion, local hematosis, and other purposes as well. It is used in diverse locations such as heart, pericardial cavity, lung, bowel, cerebrospinal tract, eye, ovary, nasal sinus, and skin. It's used widely in the medical field. This is the second case. Within the sinus cavity, implant was displaced during crestal approach at a private clinic. Within the sinus, the implant is moving. In other words, implant is not below the mucosa, but it is on top of sinus mucosa and is within sinus cavity. If I were to remove it after 3 weeks, you would have to tear the sinus membrane to remove the implant, or else it would be impossible. After implant removal, are we going to wait a couple of months for further surgery? If you look over here, the implant is continuing to move. Lateral window was formed, and the implant within the sinus cavity was removed. You cannot really see it in this image, but sinus membrane is seriously torn, more so than shown on the image. Big laceration occurred. Following the traditional method, xenograft and allogenic bone graft was used for bone graft. On top of graft material as shown on the model, fibrin glue is used. This is used to fixate the graft material. This is immediate post-op image. This is 2 years and 6 months later. Implant is well maintained, and within the sinus cavity, bone graft material is well maintained as well. I've shown you 2 cases. Let me summarize today's lecture.
사실은 선생님들이
Sinus membrane perforation is one of the most common complications that can occur during sinus surgery.
성공이라고 말씀드릴 수 있습니다. 그래서 사이너스 멤브레인의
As mentioned in the two reviews that I've mentioned earlier, even though there's a sinus membrane perforation, this is not an absolute contraindication for further surgery. If you can do appropriate repair, you can place implant successfully. If successful repair is possible, in terms of survival rate of the implant, there's no meaningful difference.
천공이 없을 때와 그렇게 말씀드릴 수가 있고 그러면 얼마나 우리가
How can we do successful repair? In general, people use collagen membrane to do the repair. But when you use this, if you irrigate the collagen membrane, it becomes quite rubbery and it is difficult to apply it. At times, it may be difficult to detect the perforated area. If the perforation is extensive, it may be difficult to do repair. In the two cases that I've shown you, the perforation is quite big to use collagen membrane for repair. If you use fibrin glue in this case, you'll be able to repair it successfully, and this will not affect the survival rate of the implant, as well as the success of bone graft. I hope this lecture will be of help in doing sinus surgery. Thank you for watching.